What causes eye bags?
Puffiness under the eyes is one of the most common concerns affecting men and women of all ages and ethnic backgrounds. The retail shelves are full of creams claiming to get rid of under-eye bags. Many of my patients come in with bags of these creams and other DIY remedies which all fail to deliver any of the benefits they claimed. The social impact of having eye bags can be very significant. Younger people who are healthy and energetic are frequently perceived by others as being tired, lacking in sleep, and even under the influence of drugs. I'll discuss the different causes of puffy eye bags as well as treatments including non-surgical and surgical options to help people who I see with eye bags. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been practicing in New York City and Long Island for over 25 years. When people come to see me, they often report that they tried everything they could before taking the big step of coming in to see me. They often will say how they were hoping to avoid needing surgery. I say to them, although surgery may be appropriate, I'm more than happy to help people who are candidates using non-surgical procedures when appropriate. I reassure them that being a surgeon provides a unique insight that enhances my skills in performing non-surgical procedures. Puffiness under the eyes can be seen temporarily due to the lack of sleep, from allergies, and even salt intake. These types of puffiness are caused by fluid and is subject to lifestyle and environmental factors. Under-eye bags, which are always present, are due to an anatomic issue called lower eyelid fat prolapse. Anatomically speaking, fat pads exist in compartments around the eyes and can shift forward like a hernia. The term for this phenomenon is lower eyelid fat prolapse or herniated fat. Lower eyelid fat prolapse can be hereditary, such as that many of my patients are younger people in their 20s and they've had their puffy eye appearance since they were teenagers. Facial aging changes, which are characterized by volume loss affecting the bones and soft tissues, can also be associated with under-eye fat bags. Certain lifestyle factors like smoking can also contribute to weakening of the delicate tissue around the eyes, resulting in puffy eye bags. Thyroid eye disease can also cause you to have prominent under-eye bags. Having puffy bags under the eyes is commonly perceived by others as you looking tired or lacking sleep. One of the most common phrases I hear from my patients who have under-eye bags is, "I'm tired of looking tired." It's important to recognize that under-eye puffiness is often associated with a deficiency in volume below the eye. This means that you can have too much volume pushing forward from lower eyelid fat prolapse, resulting in the appearance of under-eye bags, and at the same time have hollowing due to the lack of volume in the bone structure below the under-eye bags. When I perform an examination of this area for rejuvenation, I look at specific anatomic details. One, I look at how much the bags under the eyes are pushing forward. Two, I look at the area of the tear trough and determine if the height of the under-eye bags are more or less than the height of a bone located just in front of the fat pocket called the anterior lacrimal crest. And third, I look at the projection of the cheekbone and the area below the under-eye bags. The strategy for this assessment is to determine if your appearance can be improved non-surgically with the placement of hyaluronic acid filler or by performing surgical sculpting of the prolapsed fat pockets, or even a combination approach using both surgery and cheek filler. Let's look at a situation where the fat prolapse is minimal and the projection of the anterior lacrimal crest, or the bone structure located towards the inner corner of the eye, is at least the same height or higher than the height of the fat. I can precisely place hyaluronic acid filler in a space between the fat and the bone to create a smoother transition and effectively camouflage the prominence of the fat pocket. I perform this procedure in my exam room, and my patient leaves the office with little evidence of having had a cosmetic procedure. I often see people who went to injectors to have filler placed in order to camouflage the under eye bags, and these bags were simply too large to address with filler alone. That's just time and money being wasted. When under eye bags are too prominent to camouflage, I recommend a surgical procedure called lower eyelid blepharoplasty. I find that most people I see who are interested in improving their lower eyelids become familiar with this term through their online research. Some confusion occurs because surgeons offer different opinions on the type of surgery and the type of anesthesia that they recommend. Let's start with the type of surgery. The most commonly practiced approach to lower eyelid blepharoplasty is with a transcutaneous approach. This means that the surgeon operates on the lower eyelid fat pockets through an incision made below the eyelashes. In order to access the fat pockets, the skin and supporting muscle is cut and separated before the fat pockets are sculpted. It's common for the surgeon performing this type of procedure to remove skin with the expectation that the wrinkled skin will look tighter afterwards. As a specialist in primary cosmetic and revision eyelid surgery, I can attest to the fact that many patients who have surgery performed in this way are at greater risk for problems such as lower eyelid retraction and ectropion, partially due to skin shortage. At a minimum, many people who've had surgery performed in this fashion report that the shape of their eyes change in a way that is not characteristic of their original natural appearance. They feel their eyes look too rounded. These types of results are due to compromise of the delicate anatomic support structures responsible for retaining the natural shape of your eyes. In addition, the removal of skin under the eyes is based on an assumption that there is excess skin. In my experience, most people don't have excess skin, but rather have a deficiency in their skin quality. In essence, the skin appearance characterized by wrinkles and discolorations is due more to a loss of skin quality and not an excess of skin quantity. In my practice, I perform most of my lower eyelid blepharoplasties using a transconjunctival approach. This means I approach the fat pockets to be sculpted from behind the eyelid, thereby avoiding any external incision. This approach also allows for the preservation of the delicate structures supporting the eyelid and maintaining your characteristically natural eye shape. This procedure is considered more specialized and technically advanced. The art of performing this surgery is in how I sculpt the fat and at the same time preserve fat so you can look as if you never had under eye bags. My patients enjoy a more natural appearance and not looking tired as they did before. In order to improve skin quality, I use devices and regenerative technology for the purpose of refreshing the skin appearance and improving the skin quality through collagen production. I'll routinely use a combination of lasers such as fractional CO2 laser, fractional erbium laser or radiofrequency instruments to accomplish this. In order to further optimize collagen production and generate new blood supply to the skin, I also use PRP or platelet-rich plasma. Platelet-rich plasma is a concentration of the wound healing elements in your blood necessary when you have an injury like a simple cut. I see a lot of patients who have significant fat prolapse resulting in very large under-eye bags. Oftentimes the patient is so concerned about the bags under their eyes that they don't recognize that the volume loss that was present below the bags as well as the volume loss also affecting their cheekbones. During consultation, I'll often suggest having cheekbone or cheek enhancement with a long-lasting hyaluronic acid filler at the same time of their surgery. The technique I employ is derived from surgical techniques used for placement of silicone cheek implants. I use the term structural volumizing for this as I'm able to create an improvement in volume and definition resulting in a more youthful appearance with hyaluronic acid fillers. This is in contrast to conventional approaches to filler placement in the cheek area, which is generally performed by placing the hyaluronic acid filler just below the skin. This approach ends up creating frequently a stereotypical rounded or pillowy look, which is far from youthful. The results from addressing under-eye bags as well as enhancing cheekbone appearance can be highly satisfying for the patient. As far as anesthesia is concerned, I perform transconjunctival blepharoplasty with local anesthesia and light IV sedation. So many of my patients are comfortable and are able to recover very quickly. My patients appreciate being able to avoid the risks and recovery associated with general anesthesia. You're able to return to work in about a week with minimal swelling or evidence of surgery. As a specialist in cosmetic eyelid surgery, I've been able to help my patients with under-eye bags improve their appearance non-surgically, surgically, and as well with a combination approach. Since the appearance of your eyes has such a significant impact on how you're perceived by other people, it's important for you to understand these basic principles so you can make an informed decision when you're ready to take the next step. I hope you found this information helpful. Thank you for your question.